This episode, we will discuss passive transport and active transport. You have done passive transport and active transport in physiology. Here, we will review it in brief. 1. Passive membrane transport. They have two characteristics. 1. By diffusion along a concentration gradient, electrochemical gradient, by virtue of its solubility in lipid bilayer. 2. Do not requirement for energy and carrier. Transfer is proportional to magnitude of concentration gradient across the membranes, to the lipid-water partition coefficient of the drug, and to the membrane surface area exposed to the drug. The greater the partition coefficient, the higher is the concentration of the drug in the membranes, and the faster is its diffusion. Steady state. When the concentration of unbound drug is the same on both sides of the membranes, the drug reaches its steady state. 2. Carrier-mediated membrane transport. Sometimes we call it active transport. They also have two characteristics. 1. Movement against a concentration gradient or electrochemical gradient. 2. Requirement for energy and carrier. The energy was provided by natural and potential ATP paste. Look at this graph. It's a passive transport and active transport. Passive transport, sometimes we call it down mountain, and active transport, we call it up mountain. Because in passive transport, the drug diffuses along the concentration gradient, but in active transport, the drug diffuses against a concentration gradient. And the passive transport not requirement for energy or carrier, because the concentration gradient provides its energy, and the active transport requirement for energy and carrier. Active transport, for example, uptake of iodine. Iodine injected in the dye reaches the circulation in the form of iodine. Its concentration in the blood is very low, but the thyroid efficiently and actively transports the iron to his brain cell. Here is thyroid, here is blood, and here is brain cell. The uptake of iodine is in active transport. Active transport. About carrier. Carrier has saturability, selectivity, and competitive inhibition by co-transported compounds. Saturability. It means if the drug concentration is large enough, all the binding place of a carrier was occupied, there will be no place for drug to bind. Selectivity. It means different drugs select to bind to different carrier. If two drugs bind to the same carrier, there will be competitive inhibition between two drugs. For example, penicillin and probenecid bind to the same carrier. Penicillin has 10% renal excretion by glomerular filtration and 90% by tubular secretion. When penicillin used together with probenecid, they could compete each other to bind to the same carrier, and the excretion of penicillin from tubular will be decreased, and the blood concentration of penicillin will be increased. So, when penicillin used together with probenecid, the effect of penicillin will be increased. Sometimes, this competitive inhibition could cause side effects. For example, drug-directed and uric acid could bind to the same carrier. Drug-directed could cause hyperuricemia or precipitate the attack of gout. One of the reasons is that the drug-directed competitive inhibit the uric acid to bind to carrier and decrease uric acid to excrete from tubular.